Hi, I'm Renee Schmiel. I'm the digital content producer for the University of New Haven. I am joined now by Dr. Summer McGee. She is the Dean of the university's School of Health Sciences. She's an expert in health policy, bioethics, healthcare management, and since the coronavirus global pandemic started, she has been all over the news, speaking with outlets that include the New York Times, Newsweek, Fox News, as well as news outlets across Connecticut. And Dr. McGee, thank you so much for joining us today. We appreciate it.
Thanks for having me.
Oh, you're welcome. Just to start off, what's the latest? What should people know about the virus and the pandemic?
So there's a lot to know, and there's a lot that we still don't know. And so I think that's probably one of the most challenging things for people right now. Of course, what we're seeing across the country is that social distancing has worked, that we are seeing cases and hospitalizations begin to decline. So it suggests that the activities that we've been undertaking for the last 6 weeks or so are beginning to work. And so I think as we look to reopen the country, we know that there are some things that we're going to need to continue to do, like social distancing, to keep us safe. But there's still a lot of unknowns on the scientific front and on the medical front that it's going to take us many more months before we really understand all we need to about this virus.
And there's been so much misinformation out there, too. That's been one of the issues. What are some of the misconceptions that you've heard, and what are some of the facts?
So I think a big misconception early on with the virus was that this was a disease that only impacted older people. Now we know that across all age groups, everyone is potentially at risk. We also know that people with particular chronic conditions like diabetes and heart disease are at particular risk, but we're also seeing young, healthy people in their 20s and 30s and 40s who are not just getting sick, but dying from this virus. So I think that was one big misconception early on that people really didn't fully understand. I also think that there are some misconceptions around the use of masks and how and why masks work. I think most people think that by putting a face covering over your face that you're protecting yourself from others, but it's actually the reverse. You're keeping those aerosols inside your fabric face covering and potentially then not exposing others. And so it's really, really important that people wear masks and face coverings properly, because no one really knows at this point who's had the virus, who's been exposed to it, or whether people can even become immune. So I think that's the last thing I would say is there's been a lot of talk about immunity and people getting exposed and ideas like herd immunity. And the truth is we just don't know yet whether or not herd immunity is possible, whether people who have been exposed to this virus will be immune, and even if they are, for how long. So a lot of the things that we are talking about and thinking about as a country are really based on some really major assumptions that we still need to verify with science.
I want to revisit the issue of masks. I know that's been an area where there's been a lot of misunderstanding, a lot of misconceptions. Where do people need to wear masks, and how do people need to wear masks? Is there a certain type of mask they should be wearing?
So wearing masks when you're outside of your home is in some places required by law and in other places just strongly recommended. So depending on what part of the country you're in, you may be working under different guidance. It's very important that your mask be worn properly, which means over your nose and mouth, covering those areas tightly, but not so tight that you can't breathe. That's, I think, an important thing for folks to remember. I think that, of course, we would all like to be able to have the highest quality masks possible, those N95 masks that filter out 95% of the particles that come into your airflow. But because there's such a shortage of those right now, we're really recommending against everyday consumers and people in the public getting those masks as well as medical grade masks. We really recommend saving those for healthcare professionals and using face coverings, whether homemade or bought online, to be able to try to protect yourself from spreading the virus.
And what about homemade masks? Can those be effective? And if so, what kind of homemade mask would you recommend?
Homemade masks can be effective, and there's been some recent research that suggests that they do have widely varying effectiveness based off of the cloth material that's being used. And so very recent studies just in the last few weeks have shown that there are some materials, loosely woven materials, scarves, and things that are knit are not good for masks. And while there is sort of a sense of, well, something is better than nothing, I think you want to use the very best material possible. So homemade masks made out of bed sheets, denim, a nylon covering over those have been shown to be very effective as well. So there's a lot of materials that we have at home that you can use. Shop towels, even coffee filters and paper towels are effective at filtering out particles. So any of those used in combination to make an at-home mask, I think, can be very effective. And anytime you're leaving the house, you should probably put one of those on.
And I want to return to who's most at risk for a moment. Are there any other risk factors that make somebody more likely to develop complications from the virus, whether we're talking about pre-existing conditions or even lifestyle choices?
Yeah, so I think that we do know that people who have heart disease, hypertension, asthma, diabetes are at much higher risk of getting critically ill and even dying from the coronavirus. We also know that obesity is a risk factor. We also know that people who are struggling with any kind of immune deficiency can also be at risk. Most recently, what we've learned, though, and this is something that scientists really fully don't understand, is that men are 2 to 3 times more likely than women to die from the coronavirus. And so there are some hypotheses about how estrogens and other hormones may be protective and may help you modulate your immune response and mount a better immune response than what men have. So I think that's something where the jury is still out, but we are seeing, and the reports are saying that it's much more likely for men to be in the ICU experiencing severe respiratory distress than women. And so I think, that's something just to take into account. I hear a lot of anecdotal stories about how it's the men in households who are going out and running errands and doing things, and they could be potentially putting themselves at much greater risk. So I think that men need to be even more mindful of washing their hands, wearing masks, and taking every precaution.
And speaking of anecdotal evidence, I'm sure you've been in touch with healthcare workers who are out in the front lines. What have they been telling you? What have they said?
So I think the reports from most healthcare workers have really been very sobering, that they in their lifetimes have not seen a virus this aggressive, this quick to kill people, and with so many varying responses. Initially, we thought this was really just a respiratory disease. We saw people coming in with shortness of breath, coughing, but now we're seeing that there are large numbers of patients that are developing blood clots, that are developing kidney failure, that are having gastrointestinal problems. So this is not a one body system disease, which makes it really hard to treat because you're fighting a war on multiple fronts. And so I think what healthcare providers are really struggling with is the complexity of how people respond. And there isn't a one size fits all presentation, and there certainly aren't any one size fits all effective treatments that are available. And so I think that's another real frustration, is that a lot of people are coming in very late in the course of their disease, very sick, and there's not much that can be done for those patients at this point.
And looking ahead a little bit, what impact do you think this will have on healthcare long term, even when we talk about something like telemedicine? How do you think this is going to change the healthcare system?
Well, I hope it changes our healthcare system in a lot of ways, because there's lots of room for improvement in our healthcare system. I think that some of the things that happen through the CARES Act, for example, being able to reimburse for telemedicine, is a great advance. I think people are going to realize that many parts of healthcare can be done remotely, and that will alleviate some of the pressure on our facilities and our systems. I think that healthcare is also going to change because we're going to have new heightened PPE and infection control standards in hospitals and healthcare organizations. We saw this after the AIDS epidemic, that those standards change. I think we're likely to see those standards change again. I also think we're going to see a lot of young people going into healthcare. I think that we're going to see people realizing now that it's really more important than ever that we have an adequate supply of nurses, doctors, respiratory therapists. And so I think this is really going to have a very dramatic impact on our young people to want to go into these careers and to be able to make a difference.
And looking kind of beyond healthcare, but just kind of society as a whole, do you see any lasting, whether it's policy or just, among people, any changes that you think will be lasting because of this?
I think for a lot of industries, we were forced to realize that telework is possible. And I think that telework will become much more common across many, many industries. I also think that as a society, we had this American ethic of if you're sick, just go to work, power through it, don't take a day off. It's a sign of weakness if you get sick. Now I think people realize if you're sick, not only is it good to stay home for you, but it's good to stay home for your coworkers to protect them from sickness. So I think we're going to see different attitudes around work and wellness and health emerging as a result of this. I also think for the foreseeable future, we're going to see that people are going to maintain distances in different ways and think differently about large venues and gatherings. I think that we're going to have a heightened sense of disease and infection for a long time to come, which may be a good thing. I think none of us were probably washing our hands enough, and now we're all washing our hands like crazy. So I think that some of these things are very good things. Some will be challenges for our society, but overall, I think there's no doubt that not only our American culture, but all of the cultures around the world have been changed as a result of this.
Certainly an increase in health consciousness, I imagine. I want to switch gears a little bit and talk a little bit about testing. That's been something that hasn't been as available as it could be. Why is universal testing so important, and what impact could that make on the fight against the coronavirus?
Universal testing is critical to ensuring that we catch cases early and that we're able to trace those cases and be able to quickly isolate those patients who are able to spread the disease to others. And so this is a vital part of our reopening strategy as a country. And I think that we are ramping up our testing capacity every day, but we still have a long way to go to get to the level of testing. If you think about, we have to be able to test every 2 weeks, every American in the country, right? And so to be able to do millions of tests a week over a 2-week period, that's a lot of testing, that's a lot of healthcare personnel, and we're just not there yet. And even the tests are not completely validated at this point. So I think that there's still a very long way to go, but once that testing is universal, I think people can more confidently return to work and return to normal activities because we know we'll be able to catch it early enough to prevent the kind of spread that we've seen in the United States where hundreds of thousands of people were exposed before we could really get a handle on the disease.
And what about contract tracing? That's another thing that's been talked about as a potential to help curb the spread of the virus, but there are also some privacy concerns, ethical concerns. Tell us a little bit about that.
Yeah, so contact tracing is probably one of the most classic public health techniques to track down diseases, whether it's foodborne illness or whether it's infectious disease, tracing back where the infection came from, right? And so it's incredibly effective when done well, but the problem is it is very labor intensive, so we were going to have to staff up our public health workforce tremendously. Some estimates say we're going to need, hundreds of thousands of contact tracers around the country to be able to staff this up. And it is invasive. It requires people to be honest and report where have they been, who have they interacted with. And that's something that many people are not eager to, tell their local or state government where they've been and what they've been doing and who they've interacted with. So it's going to require Americans to trust our government. It's going to require us to really staff up to be able to do it well. But it will be a key part of the strategy to successfully control disease and reopen the country.
And speaking of reopening the country, certain states now are opening certain businesses like, say, bowling alleys or barbershops. Is this something that you see continuing? Is this something that could possibly put more people at risk?
So I think we will see some experiments in some states like Texas and others with opening up businesses, more essential businesses and even non-essential businesses. I think that what we're going to see is that these reopenings of these venues where large peoples can gather is a mistake. I think we're going to see cases resurge in those areas, and I think we're going to have to pull back on those policies. I think what New York is doing with a very controlled reopening of construction and manufacturing and places where those workers can work socially distant and can be monitored carefully is a much better way to go than what we've seen in Georgia and Texas. And I fear that a month from now, we're going to see large clusters of cases in those cities because people went out. This is not a time to indulge in luxury activities as much as we all would love to go out golfing or go to the beach or go to a movie theater. It's really time to focus on truly reopening the essential parts of our economy and keeping everybody else at home and protected.
And one of the concerns, too, is the possibility of a second or even a third wave later in the year. What are your thoughts on that?
I think we are going to see multiple waves as states reopen. It's a given that there are going to be, as we reopen, there will be new and more cases. That's just a certainty. The question is how many and can we control it? And so, what I've likened this to is, we can have a giant tsunami of cases like we just had in New York and other places around the country. We can have waves that we can surf on, or we could have ripples, like dropping a pebble into a pond. If we can figure out a way to make those new cases into ripples and not waves and not tsunamis, we will be able to reopen the country and be able to manage this. But we have to do it in a very stepwise fashion and really be cautious as we're doing it. And I think that that's what we'll see in some states, whereas we'll see other states really struggling to get this under control and do it right.
And to wrap up, two parts. One is, what would be your overall message to the public right now? How should people be protecting themselves and their loved ones?
I think that what we've been doing is what works, and we should continue to do it as much as possible. Even as the economy reopens and people are able to go back to work, time spent outside the home, time spent with people outside your family unit should be kept to a minimum. We should be wearing masks. We should be washing our hands. All of the things that have been so effective at controlling the virus, we should continue for the foreseeable future. I know people are eager to go back to work and to go to restaurants and to be able to do all those things that we used to do. And we will get there. But I think we have to be very cautious as we do so. So I think that it's important for Americans to know we will get a cure. We will get treatments. We will get vaccines, but that we have to be in this for the long haul. So getting impatient and wanting to just run back to our normal life, I think isn't going to happen. I think this is our new normal for the foreseeable future, wearing masks, socially distancing, all of those things. And so I think the sooner we accept that, the better off we'll all be.
And lastly, what would be your message to healthcare workers who are now on the front lines of this pandemic?
Well, the first thing I would say is thank you. We couldn't have gotten through this crisis without you. And I think that it's incredibly important to acknowledge their sacrifice and the work that they've done. I think the other important message to healthcare workers is we won't forget what you went through, and we are going to improve our healthcare system. We're going to get better protections, more equipment. This pandemic really caught us a bit off guard, but when the next waves do come, and hopefully they're ripples and not waves, but when the next wave does come, we're going to be more prepared to protect you and to be able to respond to this. And so I think that healthcare workers should take some comfort to know we did get through this when we were caught off guard, and that we'll be more prepared to respond the next time this comes around.
Thank you so much. Dr. Summer McGee, Dean of the School of Health Sciences at the University of New Haven. Thank you.
Thank you.